I just, again, think it's important to reiterate how low a PSA can be to detect disease. Before PSMA PET CT scanning came around, we used to call it oligometastatic disease when somebody's PSA would start to rise. And the reason we use that term is because we couldn't see it. And with all the previous types of imaging modalities, bone scan and CAT scan technology, they were just inadequate for detecting recurrent prostate cancer with those very low levels of PSA. So now we have the ability with these PSMA PET reagents to actually detect prostate cancer in ranges before that were known as undetectable or oligometastatic disease. So can you comment a little bit about the advantages and how low some of the PSA levels can be for these tests to be positive and detect disease?
Yeah, I have a rule of thumb when I talk to patients about this, because a lot of patients want to know when you're ordering a test, how you're going to use it, what's its likelihood or pre-test probability of being positive. But I think when you look at these PSMA agents now, if the PSA is less than 0.5, you have about a 30% chance of detecting something, give or take. If the PSA is about 0.5 to 1, it's about 50%. If it's 1 to 2, you're up in the, maybe 70, 80% range. So as the PSA goes up, your likelihood of finding where it's coming from and directing therapy based on that, or tailoring therapy, really goes up. Now, and like you said, Dr. Lutz, when you're looking at the agents or the imaging studies that we used to have, bone scans, CT scans, which are good and we use for many cancers, a PSA of 2, you're not finding anything. Like it's the detection rate is around 0. So 80% of the time with a PSMA PET, you're finding something around, a PSA of 2. Conventional imaging or bone scan CT, very, very, very low.